Are pancreatic pseudocysts cancerous? Pancreatic pseudocysts are not cancerous. They are benign, fluid-filled sacs that form as a result of pancreatitis, which is inflammation of the pancreas or from trauma to the pancreas. Unlike true pancreatic cysts, which can arise from the pancreatic tissue itself and may have the potential to become cancerous, pseudocysts are simply collections of pancreatic fluid, enzymes, blood, and dead tissue. These are encapsulated by a fibrous wall and do not have a true epithelial lining. This key distinction is important because pseudocysts are inflammatory in nature rather than tumor-forming. Pseudocysts typically develop after an episode of acute or chronic pancreatitis or after an injury to the pancreas. When pancreatic fluid leaks out, it can collect in the abdominal cavity and become walled off by surrounding tissues, leading to the formation of a pseudocyst. The prefix pseudo means false, indicating that these are not true cysts with an epithelial lining but rather inflammatory fluid collections. When it comes to cancer risk, pseudocysts are different from true pancreatic cystic tumors, such as mucinous cystic neoplasms or intraductal papillary mucinous neoplasms, which can carry a risk of malignancy. Pseudocysts do not contain cancer cells and are not precancerous. It is crucial to differentiate between pseudocysts and cystic tumors because some cystic tumors can be malignant. This differentiation is typically done through imaging studies like computed tomography or magnetic resonance imaging, and by analyzing the fluid within the cyst. Pseudocysts usually show high levels of amylase and low levels of tumor markers, while cystic tumors often have elevated tumor markers. Although pseudocysts themselves are benign, they can lead to complications such as infection, rupture, bleeding, or obstruction of nearby organs if they grow too large. These complications may require medical intervention, but they do not indicate cancer. In the context of pancreas health and pancreatic cancer, it is vital to accurately identify pancreatic pseudocysts to avoid misdiagnosis and unnecessary cancer treatments. Pancreatic cystic lesions should be evaluated by healthcare professionals using imaging and fluid analysis to distinguish benign pseudocysts from potentially malignant cystic tumors. If you have pancreatic pseudocysts, it is essential to seek personalized medical advice for proper monitoring and management, especially if you experience symptoms or if the cyst increases in size. In summary, pancreatic pseudocysts are benign inflammatory lesions that do not have cancerous potential. They are distinct from true pancreatic cystic neoplasms that may pose a risk of malignancy.